I am a reason. This is the message hundreds of people are spreading as part of a nationwide movement after the Health Minister, Varadkar, admitted a €12 million underspend in the mental health services. Various movements took place around the country, and the message is quite clear: enough is enough.
Well, frankly, I'm absolutely disgusted. Our mental health service in this country is already overstretched, and it's absolutely ridiculous. And it's people are losing their lives over this.
The people of Ireland are either leaving or they're committing suicide. Instead of taking away 12 million, they should be adding 12 million.
The mental health crisis in this country is an epidemic, and if I'm just to make an example of where I live myself, I'm from Galway, but I'm from a place called Oranmore, and almost weekly at this stage we hear of coastal rescues for another person who's gone missing, another son or daughter, another sister or brother.
I think what they're saying to the young people of Ireland, like they've said in relation to emigration, in relation to jobs, in relation to so many other issues that affect young people, is the government saying that they don't care.
I live near the barracks, and every night that I hear the helicopter going out, the search and rescue helicopter going out, it's just another time where I'm wondering who's going to be found now, who's dying now. It's an epidemic that people aren't talking about. This is what has broken the camel's back now for young people, because we cannot cope anymore. We're literally being told our country doesn't care, and that's terrifying.
While this isn't the first time that there has been cuts to the mental health services in Ireland, the recent setback means there is added pressure put on the workers in the organisations to help those that are in desperate need.
This is a private counselling centre, and while they're very good public run counselling centres, they don't have the resources to cope with the needs of the client service, the client user that they have. So it overspills them that people who are finding it financially difficult already and are stressed and vulnerable states, being told that there's an 18-month waiting list for them to be seen by a counsellor. So now there's the financial burden of coming to a private counsellor.
It's really dangerous to take 12 million out of a system that is already underfunded. The attitude that people who are experiencing the HSE mental health section is that nobody cares about them, that they are not being followed up, they're not being treated with compassion and care, and often that's not the ground level staff's problem. That's due to staffing, that's due to training issues. It's about the overall attitude of the government, and the double-edged sword of having such a strong charity sector in this area is that the government is too reliant on them. If Pieta House Consoled Samaritans disappeared tomorrow, we already have one of the highest suicide rates in Europe. It would be insane.
While the stigma associated with mental health in Ireland is very much alive, it has vastly improved in the last number of years.
Something that nobody would talk about 10 years ago, mental health. Every single person in the country is seeing something about it every week, whether that's a celebrity talking about it, a blog, something like the Darkness into Light movement with Pieta House, their ads, anything. It's out there a lot more, and people are starting to take notice.
I going in with sports club now, and the older generation of the sports clubs and the management's team will say, oh, there's no point in coming here with counselling and mental health initiatives. The young lads, they just won't talk, they won't open up. But what I have found through my own personal experience and professional experience in the last year is that I have had so many self-referrals for young people with suicide ideation. These are the young people that are being told, or I've been told, won't talk, but they are talking, they're crying out to talk. People are so frightened of, God, will I upset them if I ask are they down? Maybe, just maybe, you're now giving the person to a time and the freedom and the permission to talk about it, you know, and not to walk away from it. And don't be frightened to say, I can see that you're struggling. It seems really that you are struggling. I don't know if I can support you, but I am here and I will help you find support. So if you're frightened of taking on that support, to enroll yourself, don't be frightened. Say you're not able for it, that's okay. You're not a qualified, trained person to do that. But you can hold somebody's hand in to walk in a door and leave them in the care of a professional.
Sinead Healy, UL News, Galway.